Hello, good people, citizens of internet, friends of O Doctor. I welcome you once again. If you are joining us for the first time, God bless you for coming. This is your one-stop YouTube channel where you can learn from the mistake of others. As long as health is concerned. What in essence do we do here? We use our clinical experiences to uh, share you things that will be of benefit to you. You learn from, errors and mistakes and acts of negligence from patients. Okay. So today I want to talk about antenatal care generally. To give you a very brief overview about everything you are supposed to know about antenatal care. So I will start like this. What is antenatal care? Antenatal care means the care that is given to a pregnant woman before she gives birth. Okay, once she start giving birth, it is no longer antenatal, it is now intrapartum care. Okay, so in the labor ward, there is a care that is also given to you during the intrapartum. Okay, after giving birth, there's also a care given to you called postpartum or postnatal. All right, so today we are talking about antenatal care. So when are you supposed to register for antenatal? Once you get pregnant and your pregnancy is up to like 3 months, like 12 to 13 weeks, you are expected to come to the hospital and register for your antenatal care. You are not supposed to go to a traditional native doctor to do that because unless you want to jeopardize because you might put the pregnancy at risk. And I just made a video and told a story of a patient that lost the baby at 8 months. Okay, the pregnancy is about 8 months pregnant, and she was coming to register for antenatal at that time. Okay, and before then she has been going to a native traditional whatever. So when she came to for the antenatal, we did scan and there was no fetal heart rate. The baby has died uterine, has died inside the womb. So that underscores the essence of registering on time. Okay, so when you register, there are some tests that will be done. Typical among them is one, the major infections like hepatitis B. We would like to know your hepatitis B, status. Yes.
Good evening.
Good evening.
Hello, sir.
Thank you.
Hello, sir.
Thank you. Sorry. So we would like to know your hepatitis B status, and if so we would like to know your hepatitis B status, and if you are positive for hepatitis B, your baby will be given an injection, called hepatitis B immunoglobulin, so that the infection will not affect the baby at birth before we talk about immunization. Okay, so imagine that you are hepatitis B positive and you do not come for antenatal, and you now you just give birth and you are hepatitis, you have put the baby at risk and you have not helped the baby. So another test that we do is also HIV virus 1 and 2. We also do that one to know if you are positive or not. There is a protocol for managing, HIV positive women. Okay. We also do hepatitis C test. We also do syphilis VDRL test. We also do pregnancy tests. Okay, to be sure that you are even pregnant, because it has happened. Somebody came for antenatal and it happened that she was not even pregnant in the first place. That's a story for another day. So we'll do pregnancy tests, as that should be number one to be sure. Then we'll do your sugar test too. Okay, because of diabetes in pregnancy or pregnancy-induced hypertension, pregnancy-induced diabetes. Okay, what we call gestational diabetes. Okay, we also check your blood pressure for pregnancy-induced hypertension or even chronic hypertension. Let's say you have BP and you are now pregnant. Okay, Then your genotype too. Anyway, even though by now you should must have known your. Of course, there's no way you get married without knowing your genotype. I'm assuming because I know some people do that, unless maybe they didn't plan the pregnancy. That's also understandable. Then your blood group too. Okay, we would like to know whether you, in case you need blood, we would like to know your blood group on time. Okay, and even before you get pregnant, you can also bleed yourself. Let's say you want to get pregnant next 3 weeks. Let's say you get married today. You can go to a good hospital that has the facility and donate your blood. They will store it, okay, for you. Just in case you deliver and need blood, they will not give you back your own blood. That is, devoid of risk, right? But apart from that, we will also know check your blood group so that um, in case you need blood, we will not start throwing up and that. We already know your blood group. And also your rhesus, status. If your rhesus negative, there's also a protocol. You would also need one injection. There's an injection that will be given to you. Okay, in case your baby, if you're rhesus negative and your husband is rhesus positive. Okay, so that's why we do that. Which other test do we do? Then we also do your blood test like PCV, to know your blood, whether you're anemic or not, because pregnancy, the baby is also taken from your blood. So you should have enough. So we check your blood and then to know that. Then of course we do scan, all right, to know the proper date of the pregnancy and to know if there's a deformity. Okay, know if there's a deformity. Then we also check your urine. We also do urine tests like urinalysis, typical urinalysis. Urinalysis show a lot of things, whether there's glucose in urine, blood in urine, the pH of the urine, whether there is a white blood cell in urine, whether there is a, pus. All these things show us have their significance and we interpret and then manage accordingly. So as you can see, it's something that's worth it for you to come. Then apart from that, we also check your blood pressure and monitor your clinical, general clinical state to know everything is not about the laboratory. There are some things the doctor would see, and pick up immediately that, the test may, because we cannot keep doing every test in this world, okay? But there are some things that by me asking you questions, the doctor will find out, all right? So we also check if you have any other medical conditions like hypertension, diabetes, dyslipidemia, heart failure, sickle cell disease, um, asthma, chronic obstructive airway diseases, any other medical condition that is superimposed in the pregnancy will also be managed accordingly. So as you can see, it is something that should not be relegated. Somebody did it and, she bore the consequences. And the consequences, one of what happened, she lost the baby. And why am I telling you? So that, you learn from her mistake. All right, so what next? So that's how you keep coming. When the pregnancy is very early, you can be coming once in a month. As the pregnancy is getting closer, once in 2 weeks. As it's getting very, very close, once in a week. All right, until you deliver. When you not deliver, you not enter into what we call intrapartum care. Okay, that's not within the context of this video. So these are the basic things that compose about antenatal care. So if you are seeing this video and you think it's worth it, remember to share to your friends who may get pregnant tomorrow or next, or who are about to get married in preparation for pregnancy. We don't, most of these things you don't finish knowing them. Knowledge is a continuum and we continue to learn. All right. So thank you for listening. Thank you for giving me your audience. I really appreciate it. It's not easy.